It was an unusual first day for one nurse at Alderhay Children's Hospital in Liverpool. The Prime Minister had come here to make clear exactly how much she's expecting to get out of the government's commitment to make NHS England's annual budget £20 billion bigger by 2023.
The NHS is the public's priority, and so I've made it my number one spending priority. This is an historic moment. Our vision is clear. Our commitment is assured. So let's deliver the NHS of the future.
Listening intently, Simon Stevens, NHS England's boss and the man who'll have to deliver. So here are some of the ambitious pledges he's made today. Underpinning it all, a digital revolution that will see everyone entitled to online GP appointments and phone or web hospital consultations to save 30 million outpatient trips. A big upgrade in community care, including a 2-hour target for crisis teams to help patients in their own homes and 24/7 mental health crisis care through NHS 111. And there's a focus on the big killers, cancer, heart disease and strokes, tackled by more early detection and treatment. So what will boosting out-of-hospital care look like? Here's one example, a GP surgery in Luton, which has created more appointments through employing pharmacists and paramedics.
I think it's a surprise because culturally they would normally see a doctor, and now that we're trying different avenues, they find that seeing a paramedic is generally a great idea.
This different way of doing things helped Alexandra to be seen far more quickly when she started suffering from anxiety.
I do think it's important that it should be available to everybody, just because at that moment I needed somebody to listen to me and he was there, and I'm sure that would matter for a lot of other people as well. It's frustrating sometimes, I think, when you call the doctors and that you can't get an appointment for a long time. That opens up so much more to let people in quicker.
Employing different types of medical staff also eased the surgery's recruitment problems.
Workload on GPs has been very high, and that's tended to put younger members of the profession off. But we found actually if we can take work away from the GPs so that it becomes manageable, their stress levels go down, we support each other as a team.
This practice is lucky, but across the NHS it's the chronic shortage of staff that presents the biggest threat to this long-term plan succeeding.
Well, I think it's great that people are ambitious for the NHS, but we just need to be realistic about where we're starting from. We've had 4 years of missing all of the key NHS targets. We're 100,000 vacancies on the front line in terms of workforce, and we know that our staff have been given a really unsustainable workload. So we're not starting from an ideal place.
No wonder today NHS England's boss was keen to manage expectations by stressing change will be gradual.
We're going to need more nurses, more doctors, more therapists over the next 5 and 10 years.
They don't grow on trees.
They don't, which is why it's so important that we've got 5 new medical schools coming online, why we're going to have an increase in the number of nurse training places between 1/4 and 1/2. But all of that will take time, which is why it's so important that we phase the improvements to recognise the extra staff we will need, but also some of the big changes that the NHS needs to make.
For the last decade, NHS England's budget has not matched the growing demands upon it. This new funding package still doesn't quite match levels the health service has benefited from historically, but it does offer a chance of creating a service fit for the 21st century. And now the hard work to make that happen begins. Catherine Jones, 5 News, Liverpool.